COVID-19, coronavirus. In my opinion, it hit heavy, like, as a reality, March 11th.
I started having like a burning pain in my throat.
And I started to feel chills in my body, like I was extremely hot.
I called to check in on her and she said she was not feeling good.
It hit my whole unit. It just went from room to room to room.
And actually a couple of my mentors have actually passed away from it.
I started to get a headache, I started to get body aches, and I started to just feel really worse.
People in the doctor's office were hesitant on testing me.
I felt as if like a lot of the things that affect the Black community were hitting me all at once. It honestly really affected my mental stability.
Couple you knew, you kind of felt like their bodies just couldn't sustain this, and they might not be coming back, and you just braced yourself for it. But a lot of them were just healthy people. They had problems, but I feel it shouldn't be dead.
Didn't get a chance to tell my mom, I love you, and we're here fighting for you. I didn't get that chance, and so I was so heartbroken during that time.
The pain that you feel when your people are in the hospital, but you can't even go and visit them, it was honestly terrifying at times.
This is serious. This is very serious. And I think about if I could have been on the other side, like I could have still been in the hospital dealing with these symptoms on a much worse case.
I don't feel like this government cares about us at all. It's trying to open up back the economy, but honestly, it's not taking into account the proximity of African Americans in low-income neighborhoods, low-income places. It's not taking into account that they're not giving us the resources that we need to even properly fight this.
It is time for our communities to pivot and take an offensive stand against the legacy of discrimination that has given birth to the social and economic inequalities African Americans face today.